Ready, girls?
50-year-old Yuri Solis is a husband and father to 2 little girls. He's also an avid runner.
I love running.
So when Yuri experienced pain in his lower back, he thought no big deal.
Because the physical activity, I'm gonna just wait.
But his pain persisted.
So much pain. I couldn't do anything.
Doctors ordered an MRI, and that is how Yuri and his wife Erin found out it was likely cancer.
Of course, we're in complete shock and worried, very worried.
I have some illness in my body, but I just want to go and find what is it.
Yuri was referred to the University of Kansas Cancer Center Olathe campus.
I'll just have you on the end of the table here.
There he met medical oncologist Dr. Larry Coram and his team, who recognized right away that Yuri's cancer was different and he was very sick.
For me, this was this really compelling sort of collision of science and emotion.
Yuri, a non-smoker, was diagnosed with non-small cell lung cancer caused by a rare gene mutation.
So many of the people that sit in my exam room are dealing with the most significant, most important, and in many cases, most devastating thing that they've ever faced. Let's look at your scans here.
Dr. Coram helped Yuri face his cancer, which had metastasized.
During that time, I was very scared. I didn't want even to read about cancer. He was one of the persons that mainly gave me some kind of hope.
But Dr. Coram knew that hope would require a village.
I'm a medical oncologist. I don't have the expertise and the knowledge and the skill set of a radiation oncologist or a thoracic surgeon or a cardiologist, which we needed in this case.
Scans showed that Yuri had multiple lesions in his bones and on his liver, and there was more.
As you can see, this fluid or this blood is pushing at the right side of the heart.
Yuri was admitted and put into the hands of cardiologist Dr. Jamil Abuzatin to remove the excess fluid squeezing Yuri's heart.
So if you see between the liver and between the heart, there's no space here. That black space is gone.
Next, Director of Radiation Oncology, Dr. Bertram Maidment III, was brought in.
It became clear with advanced imaging that there was something more to the story than just chronic pain.
Yuri had 11 brain metastases in addition to the massive pain in his bones.
His pain was so severe outside the brain and the body and the bone lesions that Dr. Coram knew he needed treatment immediately. He couldn't wait for something that might take weeks and weeks to alleviate pain. We needed to get going very quickly.
Dr. Coram knew Yuri's rare ALK gene mutation qualified him for a medication to treat his very specific form of lung cancer.
Many of these people on just a pill, just a daily pill like he's taking, are going to be living years and years and years, and often in a complete remission.
Which is where Dr. Coram considers Yuri to be living. That word, remission, brings the ultimate hope.
We were basically back to living our normal lives and didn't think about cancer 24/7 like we did in the beginning.
Read them again, this one.
It's a new beginning for the Solis' story, and one that this team of doctors is blessed to play a role.
It always feels really good to know that the patient is doing well and what we've done for them is helping. So that's the best part of the job.
You go from this moment of terror, and feeling as though, this is my responsibility, right, to figure out how to get this person out of this, this predicament, to this moment of elation when you see the results and you're able to deliver that.
It makes us feel phenomenally good as a team to be able to have all the tools here to help people such as Yuri lead a productive, happy life, to create more memories and to flourish.